So you're studying pathology and pharmacology and you're wondering how to survive. I'm headed to work now. I will ensure to give you the best I know how and to do for you what no one did for me and I wish they did. So the key is to understand the context of pathology and pharmacology. In the past, they used to steal bodies, right? They would steal bodies from the mortuaries, take them to the medical schools, and they would use them to analyze. Then afterwards, what happened was that they will autopsy the patient immediately after the patient dies. And that way, the physician who was in charge of the patient gets to see exactly what went wrong with the patient. If they had palpated a large liver, they could see it physically, they could know exactly what happened. So that's how the whole concept of pathology started. It started by looking macroscopically when a body died, autopsy. And then it started going into smaller sections. They could do slices, they could take samples, and they could search and see exactly how to get their patients well. And pharmacology also had a similar start. They were using dyes. During the wartime, they converted these dyes into chemicals for war. So in other words, instead of using those dyes for clothes, they started using those dyes for making atom bombs, making mustard gas, and all those kind of things. But even at the midst of that, they now realize that this mustard gas could be used to treat patients with cancer. Pharmacology has to do with now understanding the different classes of drugs, how they interact, why they interact, and putting those classes together. So you need to understand the different classes of drugs, know examples under each class, because then you need it for the treatment in the real world. It's useful, but when you are stuck in the context of school, you don't see the value until you leave the school system. Second thing you need to do, get a copy of the schedule. You might be surprised I'm saying the schedule but you will need the schedule, right? You need the schedule because if you don't have the schedule, you will not understand what's happening and you just let the classes happen to you. You must be more proactive about it. Get the schedule, know exactly how classes are structured so that by the time they happen, you are not just confused and say, oh, I don't know what classes we did and things like that. Fun fact, one of the professors asked me what subject he taught in my Viva and I could not remember. Pay attention in class. Classes may be boring, but there are going to be some questions in that exam that are going to come directly from these boring lectures. So pay attention as much as you can. Pay attention in class. That's what I'm going to say about that. 4, get and use past questions. I can't emphasize this enough. Please find them and use them. You have to, you just have to. Take notes of key areas mentioned in class. So you can actually have your notes. I type my notes on my iPad, but you can type it in on your paper and pen and maybe have a special highlighter or maybe just in a section that says high yield. Anytime they say something and they really emphasize it or say that they might ask you that kind of question, you can just put it under high yield and highlight it in your paper. What I do for my own tab as I'm writing that I put AOC and then I put exactly what they said in the class so that when I'm going back to read my notes, when I do once in forever, close to the exams, I see that AOC and I remember what the question was and the answer was. Not all of them will come out, but if I just have a few of them come out, I've added to my score already and it worked for me. 6, make your professors like you. Please make them like you. And it can come simply by telling them, oh, so I don't understand this area, or asking them for career advice, asking them for where you want to go, or showing them what you have been reading and asking them, oh, so this is what I'm struggling with. Or it could just be something simple as the entire class, you guys showing up, keep your attendance up. What some layers have done is that they have rosters for how they skip classes so that not everybody skips class at the same time. So that let's say at least there will be at least 80% or 75% of people in the class. 80% is a good number at all times. Those you guys that like skipping class and you girls that like skipping class, you don't put your class in trouble because you might think they are gaining much by not being there, but they're getting an impression about your set by your attendance. So if you say that you are being smart by not coming to class, you are going to affect everybody. And you might not think it affects you, but the day they come to start judging your results and somebody in the class needs help based on, let's say, one score or something else, they might not be as disposed to help if you guys are not cooperating and not having good attendance scores. 7, have study groups. Absolutely, have study groups. You might already have study groups now, but please have study groups because you can get to talk about the material. Pathology and pharmacology is not the kind of stuff you just read in your head. If you don't say it out loud, you will not realize that you knew it. We started having study groups closer to the MB time. And that really helped us because when I started the group, I made sure we went through. Oh, I have some really good materials from that. You can send me a message about that study group material, preparing for the MB. I took some past questions and I compressed them into this document, and I use AI to extract the most relevant concepts from that into a frequently asked talking point questions. Okay, this is a very important one. The eighth one: go back to the accident and emergency to, I guess, practice what you learned. Now, you won't have access to actually see patients or click or anything like that. What I'm saying is that in your free time, don't go as a crowd, just one or two. Just go into the A&E, greet everybody that's there, take a look at the case notes, and you'll be surprised that the drug propranolol that you just talked about in your pharmacology, you see it again in the charts, and then you understand the milligrams and oh, this is what they're talking about. So it's a really big reminder that medicine is not just theoretical. So number 9, read good textbooks. Okay, so I will tell you to read good textbooks and I'll tell you not to read good textbooks. Let me tell you why. All the material you need to pass is in your slides. I guarantee you. And there's a problem with that approach. Likely you might have a lower score than someone who read the slides. But hear me out. If you read textbooks, by the time you get to block 2, when it's time for the MB, you'll be in a better shape than the person who read just the slides. And the reason a slide looks like it is very high yield and very important is because questions come out from the slides. But you realize that in the real practice, questions don't just come out from the slides. They come out from the book. They come out from the outside the book, from the clinics, in the real world. So what you want is to read the book, right? You don't have to like line by line, but go through the textbooks, big textbooks. I won't give you exact ones, but if you can just read through textbooks and understand the concepts by looking through the textbooks, you'll be able to connect the gaps. I'll give you a secret point right now. Start studying for the USMLE. This is a bonus material right here. I'm telling you this because I saw it work. I saw one of my classmates, she was already studying for the USMLE, and I was so envious of her. She would just call out some random stuff in class when the teacher asked the question. Only her will know the answer. And I'm looking at this girl like, what? How are you getting this answer? And she told me, oh, she's preparing for USMLE. She's reading the first 8 textbook. So last one, use AI. Use AI to explain difficult slides. I made a video earlier about using AI models. So I won't say too much about this one. My classmates are really good at AI. Leverage it in every way you can, and every way that has not yet been developed yet. Find a way to use it to make your studying easier. What resources did you find most helpful? PQs. PQs, most helpful. Most helpful. Then I also found USMLE prep material very helpful. I don't know if it would be very helpful at the very beginning, but by the time I was doing I started it in block 2. It just helped me glue all the concepts together. So maybe starting it earlier in like block 1, but you should also talk to someone else that's doing USMLE material who started earlier, whether or not it helped them. But from what I saw, it helped too. Even if you're not doing the USMLE, the fact that they combine the material, getting that first aid book and just flipping through it might give you a better understanding. But for practical stuff, your slides, if you know your slides and you do PQ, then you are golden. PQ and your slides, you are golden. What is the mode of assessment? How difficult were the exams? The mode of the assessment for intro for us was you do MCQs and you do a practical. So the practical sessions may not be really related to your actual practical sessions. So have that in mind. What they said for you in the exam might not be what they teach you during the practical. So still do the practicals well. But hematology, they are good about setting exactly the same thing because I think they're the ones setting the questions. Unlike something like Chem Path, that they teach you something and someone else, the HOD, sets the questions. So you should get close to the HOD and ask him if you can have a practical session with you early. Don't wait till the week of the exam because he might be too busy for you. And if he's too busy, whatever you see in the exam, you take it like that. And the MCQ and practical, so I think practical is like 30%. Then, of course, attendance is involved. So the MCQs are usually best answer question. They have this very annoying thing where there's worst answer question, which is very annoying. So, like, you see 4 options. They won't tell you whether you should pick the best one. You assume it's the best one, but some people will look at it and say that there are 3 correct and 1 wrong. So they pick the wrong one. I mean, as far as I'm concerned, the person who did this and was really good at it was picking the odd one out. She really had high scores. compared to most people who didn't. But I didn't. I just picked the best one I could find, and I just forgot about it because it was very annoying. How will I know which one is which at which point in time? So odd one out likely. The HODs have changed, so we didn't have any true or false except one exam. Like each option is true, false, true, false, true, false. That's number one. A is true or false. B is true or false. We had only one exam like that. That was hematology. But afterwards, they changed it. So collaborate with Prof. He's in charge. Make sure that you are communicating with him, because at the point, pharmacology wanted to to try something brand new just before our MB, and we complained to him, and he was able to prevent them from being too experimentative. Pharmacology, they want to add new stuff, so it depends on what you guys are doing right now. They will tell you. What regrets did you have about Path and Pharm? That I didn't understand the material earlier on. All the things I've told you in this video, those were my regrets. If I understood why we're doing Path and Pharm, maybe I'll do this in person with you. I got context onto why it existed as a course. I would have been able to do it better. I didn't get the big picture till I was in block 2, and not because they told me the big picture, but I was intentional about finding out the big picture. I read books not relating to school stuff, and I got the connection point. For me, once I got the connection point between the theory, the books, and what was actually being taught in the hospitals, it clicked for me. So I stopped focusing on the minor details of all those tiny cells, and I started realizing that, okay, even if I don't understand all the things that I hear, all this section in Anapath is teaching me is how, when my patient comes in with some kind of cancer, and I send my patient for biopsy, and they go to biopsy and come back, they'll present me with a result that has those big words. But all I really need to be looking at for like carcinoma, fibroma, I should know the difference between an oma and a sarcoma, or know what oma means, a swelling. I know the difference between a lymphoma, blastoma, carcinoma. Once I started breaking those big terms down, that's why I said USMLE prep is really good. It gives you a good foundation on those stuff. Check it out, Anapath Foundation. You get all these breakdowns. Once I understood that, really good. Also, if you can read, like they say, read the first 7 chapters of Anapath. I agree with them. I read it and it helped me. But if you can read that, I think Anapath, you'll be solid. But again, don't be trapped there because there's so much to read. If you don't read it, just learn the slides. But if I could, early on, I would just stick with those first 7 chapters of Anapath. Read Kuma and Clark's hematology section. But again, don't be that guy who reads everything else but the slides. That was me initially. If you read your slides 2-3 times, I promise you are going to have at least a 60. Because all your questions are from your slides. And lastly, get to know your teachers. Even the ones that don't show up. If one comes like one day, maybe just stay after class, talk with the person, ask him questions, let them know who you are. Because those guys, especially for the guys, they just have this perception about guys that we don't attend classes. Please don't let that be true. Lastly, don't trust in your own ability. Like, Path and Pharm is a lot. Lean on Lord, lean on Jesus and ask him for help. Lean on Jesus and ask him for help. Path and Pharm can take you to the edge of sanity. And I've been there, to the edge. And I know that it's God that brought me back. I would stop and pray and get back to studying. So I'm rooting for you that you will not just do as I did, you will do better, you excel way beyond your wildest imagination. And I pray that God gives you peace. Take care.